Hey everybody, Shaun Keating here. This week's Dental Up podcast. We're excited to have Dr. Jack Ringer again with us. Jack,
how you doing?
Thank you for coming back.
My pleasure. This is great stuff.
That's awesome. But we like to start off before we start talking about dental. I like to start off talking a little bit about sports. And hell, did you watch some of the games yesterday a little bit?
Loved it, man. I wasn't happy with the first result, but it was really exciting. I'm looking forward to the Super Bowl. How about you?
I am kind of. It was not my teams are in there kind of, but
who are yours?
I don't know, the Rams. So we'll be waiting for a while, I'm sure.
Yeah.
But yesterday that game at Atlanta, I never really watched Atlanta this season. I didn't have anyone in fantasy or anything. But damn, I was calling him last week. I was calling him Matt Moore, I think it was. It's Matt Ryan. Yeah, it's like. Yeah,
but how was Julio?
Matt Ryan, what a stud that dude is.
And Julio.
Julio Jones, that guy. Who the heck is Julio?
God.
That dude's like a monster. Is he really? Yeah, he had like 200 yards, I think. So really kind of impressed and not really watching Atlanta, but they looked. I mean, it was 24-0 at halftime. We're like, let's go hit another pub, man. We got to go get some different food. And so we did like called a 3-pack. We went to 3 different places, but 24-0.
Yeah, and Packers screwed up in the first half of it, though. They had a few turnovers, but nevertheless, Atlanta just outplayed them.
Those first 2 turnovers, we were kind of screaming because it was like they should have scored that first series, and it should have scored. And I don't know if it was an interception or fumble, but
the guy fumbled right at the one.
Fumbled, and then the next series, a field goal is like
missed that.
Then he missed that.
And he hasn't missed forever.
That just set the tone for the game.
Seemed
and it's like,
yeah.
And these poor Packer fans. I was sitting next to a couple of older women, and they had all their Green Bay stuff on and all the Cheesehead stuff, and there's a bunch of other people in this area that were mostly Atlanta fans, and I felt sorry for them, so I was kind of talking to them like, hey, it's all going to be okay. Rodgers is going to come back, and then after a while, it's like, I'm looking over at her, and I'm like, sorry, lady, but it ain't going to happen today.
Don't feel sorry for the Packers. They've won the Super Bowl plenty times. Atlanta has never won it, so that's kind of cool. So
absolutely, and that's why I look. I like the underdog, but good to see them. And then watching the damn Patriots, and
they're a machine.
They're a machine. They looked really, really good.
Yep.
And Belichick, the way he coaches, man, he demands respect, and the way they do it,
incredibly professional.
But like you say, like they say. Offense wins games, defense wins championships. And what do you have? You have the number 1 offense in Atlanta going against the number 1 scoring defense in New England. So I think it's going to be a good game. It's going to be a good one, but
I got to give the edge to the Patriots, though.
Yeah, I think so. I think because of the defense
and the experience,
of being there, and but these young guys over there, Matt and that Julio Jones, and so their defense looks pretty stingy too. But it'll be good. It'll be great. Just kind of seeing the same teams. It's good to see Atlanta get in there because I think I still even have a shirt from I actually bought a jersey a couple years ago when the Patriots went, and I'm wearing it around. It's a little tighter than it was a couple years ago, but I put it on last night. And Shannon, my wife, said, you know what? You're just what do you call when you jump on the bandwagon? He's like, you're a bandwagon dude. And I'm like, oh, Patriots.
Fair weather fan.
But fair weather fan. But anyway, so good for football. We got a couple weeks to go on that. I'm excited. I always hate it when it's over after that. It's it's kind of like you gotta wait like 8 months or something.
But we got hockey, we got basketball going now. Baseball will be soon.
Our Ducks are looking pretty good.
Yeah, except the other night they so blew it. Oh, God.
Did they really? Yeah.
2 best teams in the Western Conference. Ducks are up 3-1, 5 minutes left in the game, and they gave up 3 goals.
Oh, my God.
4 goals.
What the heck?
They lost 5-3.
Unbelievable.
No, sorry, they were up 3-2. They were 3-1 at the beginning of the 3rd period. But, yeah, it was like I thought, oh, great, they're going to beat the Wild.
Yeah.
But anyways,
they've been on a tear. They've been on a tear pretty good.
They're one of the best teams in hockey right now.
And they weren't for a while at the beginning of the season. They were having a tough time. And even Getzlaff, Ryan, he's pretty cool.
Well, he was hurt.
Was he?
He was hurt. And, they brought back Carlisle, their coach.
Oh, yes.
Who he used to be, so they had to get that whole gelling going again.
So they do
but
now.
They're really good. You got to go with me to a game.
Yeah, let's do it. Heck, I want to look at. I haven't. Oh, do you?
Yeah.
Well, shit. I made last year. I remember Ryan took a puck to his mouth. We made his teeth. He came in, and so I went into some of the games afterwards. I'm not a big hockey. I want to go. I mean, but it's second. It's just I like when they hit each other in the glass.
Yeah, in the teeth, right? That's what you like.
Break the teeth. I want to make you some teeth. But no, that's good.
Yeah.
But also last up, do you like horse racing at all a little bit?
No.
I like betting on them. I'm not a big. Yeah, I know.
No,
I don't like that.
I don't
either.
like that.
Yeah, my wife's the same way. She goes, I don't want to see them hurt, or you have to put them down. A few years back, we had to do that.
I don't want to. Nah.
But I like betting on a favorite. When you just know it's a favorite. I've done really good because I don't bet first, second, third. I mean, that shit will take you forever.
Yeah.
But I like a guy that like this week. It's a Pegasus World Cup in California Chrome. Man, that horse from California, right here, Los Angeles. Okay, I won every race. I've won on this guy, and like the last one, there's a horse named Arrogant that beat him at the Breeders' Cup by whatever it was, very little. So I lost on him that week. But this week it's coming up Saturday, and I have a feeling this Arrogant horse. I don't know where the hell he's from, but I was gonna go California Chrome. I'm gonna go Arrogant. Bet the house on it.
How much of the house are you going to bet, dude?
A couple grand. But it's something, yeah. They have a little place like locally now, and it's called Sammy's. It's in, they have one in San Clemente where you can actually gamble and bet on horses.
Really?
And now in Lake Forest, it's a little restaurant called Sammy's. And they have it where you can bet on all live races from Gulfstream track to everywhere. But
wow,
it's kind of cool. Kind of cool to go in there and have yourself a corned beef sandwich and freaking bet on, horse races in New York, horses at Santa Anita, and shit. I was there last week, and I was only there for like 2 hours, and I bet on like 4 races. I won all 4 races. But when you're betting on the favorites, sometimes the favorites don't come in, but. I always like it. You bet a buck, you can get a buck, and so the more bucks, it's kind of neat. You bet $2 grand, you get $2 grand back. But
yeah.
But then again, I've lost on it, and so not a big gambler, but I thought I'd get that.
You enjoy it.
All right, I'll shut up on this. But all right, we're going to talk today on our dental education. We're going to talk about marketing a little bit, and I'll let you do this because. You're the dentist, and you really, I'm just the lowly dental lab technician.
Yeah.
I just make teeth, and so I've always wondered, well, what does a dentist want? What does a dentist need? And I really don't have those answers. I know how to make teeth, but with you've been in this field a long time, and you're really, been up there, and the ins and outs from regular marketing, social media marketing. I mean, it's all changing and all this stuff. So I'll let you go ahead and just go with that.
Well, sure, Shaun, thanks. So like you said, I've been in the game a long time, and marketing has drastically changed over the decades. It used to be, when I started off in dentistry, that it was a no-no to do any type of marketing as a dentist. In fact, you were forbidden to have a sign on your door that was bigger than certain dimensions.
Oh, you're kidding.
Yeah, now you see billboards and everything. You weren't allowed to do that. I guess the Dental Association thought it was beneath us to market.
Oh.
Well, obviously that changed over the years. And dentistry is a business like any other game, right? You guys are a business, everybody's a business, and we have to drive our clientele to our doors. So up until, say, 10 years ago, it was a whole different world before we had our smartphones.
Yes.
Okay? And the reality is, back then, most marketing was kind of traditional. What were we trying to do? We were trying to get people to find us in the yellow pages.
Yep.
Okay? So we tried different things, right? You'd have a lot of the analog marketing, the paper stuff, penny savers, ads and whatever, this and this, coupons.
And they even did them on cars, just in their windshield.
Sure. But the problem was, though, is the type of clientele you're trying to drive to your office. Mm-hmm. There's some dental offices that work more on a volume basis. And so they are just trying to address everybody.
Yes.
Okay? So they would offer specials,
Whitening.
or 2 fillies for the price of 1, or free this, free that.
Yeah.
Well, nothing's wrong with that if that's what you're looking for. But there are a lot of offices, mine included, that our type of clientele are looking for quality first.
Okay.
And sure, they want to have a value, but they don't want to come to us because it's cheap. They want to come because there's good quality, and then let the office work out the finances, make it more value, if you know what I'm saying. So that type of marketing is a little different. Then it becomes more of an informative thing. A dentist writing out an article, about, say, porcelain veneers or something like that. Getting certain credentials, whatever, and getting it marketed out there, exposed. Then the world changed, right? We got the social media, okay, with the gazillion different platforms from Facebook, Twitter, Instagram, Snapchat, Pinterest. There are tons of them. So what is the objective today for anybody who is marketing now? What do you think they're trying to do as far as the digital environment is? What is their objective when they do anything in the marketing world? What do you think it is? Do you have an idea? All right, well, I'll tell you. To get that person to go to Google. All right, so if I was looking for a lab, what do? I Google. Labs in Orange County. So everything in social media marketing is directed at getting people to be higher up on that Google page, the first 2 pages.
Yeah,
right?
Yeah, that's what I always heard. Like, get on the front top page and organically, I guess, instead of paying.
Organically is like you and me doing it.
Yeah.
The other way is when you buy an ad.
Yeah.
So on Google, on the top 3 are paid, and on the right-hand side, it's paid.
It's paid up here, and what's on the right?
Also paid.
Oh, okay. Yeah.
Okay. And then organically, it's 3 down.
Yeah, right below it.
So they've done studies, and they've shown that the vast majority of people, something like 75% of them, ignore the paid.
Oh, really?
Because they're just saying to themselves, well,
yeah, this guy's paying for
it. So how can I believe them or whatever? But it's still good to be in there.
Yeah.
So a lot of people who have marketing strategies will set aside a budget, and part of it will be, I want to, pay for some of to get my position higher. But the other way to keep yourself higher up on that Google page is whatever business you're in, and dentists just the same, you have to have a very dynamic and active digital footprint. So you have to have a strategy here. You have to have a Facebook presence, there's no question. You have to have a Twitter presence. You have to have a very, very up-to-date and dynamic website. Okay? Because with all these different algorithms that these companies like Google use, they figure out who is like more active digitally.
What's like an algorithm? Is that just something that...
Well, that's call it computer lingo, where they can analyze the data, and then they can figure out how to position somebody who's doing this. An example, many years ago with Google, the way people would try to be higher up is like, let's say your specialty are gold crowns. You would put in your website the word gold crown like 5,000 times.
Oh, yes.
Okay.
Keywords.
Right. Well, that's gone.
Yeah.
In fact, if you do that too much now, they bump you off.
Yeah. I think that happened to us. Some guy that did my website years back, they were writing some stuff that wasn't true writing, or using somebody and using too many words. It was like, I didn't do this, but they booted you off.
Right.
So it took us And it's just like you don't know. And like I guess Google and stuff changes the rules every once in a while.
Once in a while?
Or a lot, or I don't even know.
They change their algorithms. I don't even know. It's like 600 times a month or a week or whatever.
So crazy.
It's ridiculous.
Because they don't want someone probably
trying to backdoor it and figure it out. Right.
If you want to do that, buy it from them probably. They're saying otherwise. So it's true that the true guys that are at the top are probably policed so much that they deserve to be organically at the top because they're doing it the right way.
Right.
Which is, do we even know the right way? Are there rules to it? I mean,
well, there are some certain guidelines. Like I said, a very active digital footprint. One of the things that Google wants to see to be higher up is that you have a lot of positive Google reviews.
They don't like the net. It's kind of like Uber, where like I got a guy that took me home last night and he was a 5.0. I said, dude, I always get like 4.8s, 4.7s. He said, I'm a 5.0. I try pretty hard. He's telling me how nice he is. But I see that, you know, it's important, the ratings.
Reviews are huge. It's not just Google reviews, Yelp reviews, and other social media platforms. So there are strategies to do that too, and there are companies that can help you get good reviews. I'm working with a company called Podium, which is really good. They help you because here's the big problem. You have a magnificent operation here, right? And you've got like tons of people. Now, you probably know virtually every aspect of your business. And if you had to, you could fit into almost any one of those roles.
Yep.
But you're not gonna.
Yeah.
You have so much time to do your thing, and you hire experts to do the other things. In our game, it's the same thing. As a dentist, when I was in school, I was taught how to do a root canal and an extraction and all of those. And I could do those. But I want to focus my specialty or my expertise in other areas and refer that to other people.
Absolutely.
So
that's for sanity's sake too. A lot of guys with dentists, they try to, practice everything. Let's do the root canals. Let's do the ortho. Let's do, frickin' perio surgery. But they don't sleep at night. It's like, do what you do best. Do what you're comfortable. And just not outsource, but just refer it
it's referring to the people that know, work with a team. So there's an expression, excuse me, the definition of a specialist. You know what that is? It's a person who knows more and more about less and less until they know everything about nothing.
Yeah, exactly.
The other guy who does everything, a generalist, this is a guy who knows less and less about more and more till he knows nothing about everything. So in a sense, it's true. If a dentist is spending tons of his time on too many things, the quality somewhere, unless he's Superman, is going to kind of take a little bit of a beating. So when it comes to marketing, to me, it's the same thing. I could have one of my staff be delegated to post on Facebook or do my tweeting or whatever, or if I had the time, I would do it, or the desire. But in this day and age, it is so competitive that doesn't make any sense to me. So a few years back, I was speaking to a friend of mine. He's an amazing dentist. I think everybody in the world has known him, Bill Dorfman.
Okay.
And I called up Bill and I said, look, can you direct me to somebody who is pretty clued up on dental marketing, on which way to go and stuff? So he hooked me up with this company called Dentainment. Pretty clever name, Dentainment. And there's a guy, Brad Newman, and in fact, I introduced you to him. And his only job is social media for the dental world.
For dentists, what a trip. And you really are off the charts when my guys were looking at your site and just the whole, because we're new to it and we're trying to find our way. And like I got a guy named Zach doing mine. I don't have Dentainment, but but it's just something really off the charts. Really is neat. It's very interactive and really kind of engaging, which I think is important. But
well, even for you guys, like every day when a patient comes to my office and I ask them, "How did you find me?" Okay, I've got to kind of do some analysis on where my people are coming in, right?
Absolutely.
And virtually everybody, other than the word of mouth referrals, which fortunately we get those, it's some type of internet search.
Oh, okay.
Okay? So it's kind of like this. If you were looking for a pizza place, all right? Unless you know the name of the pizza place, all right?
Yeah.
If you went to the phone book, using that as an example, you just go to restaurants and you'd be scrolling down.
Yep.
Right?
Yep.
Because you don't know the name. So in dentistry, like I've been finding a lot of patients are also researching the labs.
Oh, really? I never knew that.
You know, in my practice, about 20% of my work is redoing work from other practices because there's just been, a little disconnect, particularly in the cosmetic world. So I'll say to them, how did you find me? Google.
No kidding.
Internet. Okay. Well, thanks to Dentainment and other strategies that we've been doing, our digital presence is higher up.
Yeah.
And, we can target it. You don't have to, if you have Facebook, for instance, Facebook, you can reach the entire world. But I'm not looking for a patient in China to come to me, right? I'm looking for people in my community.
Yeah.
So with Facebook, you can target
Areas.
So then I'd get a patient, how do you find me? Google. And we'd sit down, we'd do a consult about, their problems. Their veneers look lousy, for argument's sake. And so I start explaining to them about, dentists need certain training to be skilled in the aesthetic world. And I said, and same with my labs. I said, if the dentist is awesome, but the lab is not very artistic, you're screwed, right?
Yeah, exactly.
And so many of them said, oh, yeah. I've looked up labs. Okay? So it's not just the dentist. It's also the specialists around us.
Yeah.
Because even if they didn't on their own want to look, those particularly who are redoing their work, they research the dentist really well. Yeah. Then I have so many of them say to me, what lab do you use?
Yeah. That's new. Before they could really care less.
Yeah.
But now they're seeing that, well, the lab is a pretty important part of this.
Sure.
And unless that lab's in the doctor's office that he's bragging about, and if he's not bragging about who he's sending it to, then that's when you got to probably think, well, is he sending it? Because a lot of doctors don't have to disclose where the crowns are. You don't have to.
Well,
I'm sending it to China. I'm sending it to Vietnam.
They don't know.
Not that matters, but it's just the consistency and the quality of a restoration on your mouth. You kind of want to know where it's being done.
Sure.
And the aesthetics. I mean, we can look at guys from the 80s and 70s and 80s, the porcelain work, and we look at it, we call it like a headlight.
Right.
It's just the monolithic deadness of the porcelain is just not as vital as it is to this day and age. So it's just something, the people, I wish they would get smarter because then they are getting smarter, especially if they're redoing. They're going to say, this dentist is okay, but the crowns themselves, I wish we could, so hopefully, I like that. I like that they're looking at that because then the good labs that do the good work should maybe benefit a little bit. Maybe as the doctors have more demands from the patients saying, well, I want a top-notch lab if you could. And, well, we have no problem there. But,
Well, dentists today, because of the costs and the overheads, they're looking to find ways to cut corners. They know the vast majority of patients, unfortunately, aren't very dentally educated.
Yes.
So they really care about, is it going to hurt and is it going to cost them anything? Yeah. So if the dentist can overcome those two, they can get away with a lot of bad stuff.
Yep.
Okay, because if I put a crown in a patient's mouth and it was done pretty poorly, either on my part or their lab, but the patient didn't feel it, had big open margins or whatever, patient's not going to know, right? Until 5 years down the road and there's decay, and then the dentist will blame it on the patient or whatever, or in the lab or something like that, right? So again, thanks to the digital world, people are now going onto YouTube and they're learning.
Oh, I bet.
There's tons of education just at our fingertips, right? Take out our phone, blah, 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 blah.
Yeah.
Okay? And like I said earlier with the reviews, okay?
Like the Yelp stuff. I mean, the Yelp, I hear a lot of dentists kind of complain when I go online and listen to some of the community talking about Yelp, and it just seems like there's a lot of crazy people out there in the world. There's a lot of nasty people out there.
That will give a bad review unnecessarily.
And unless you just really, I mean, I think it's so important that customers always right. You really help.
Yeah.
But yet some of them are going to come back and bite you, and it gets you. But is it honest, or is it kind of not trolls, but people out there to kind of, so I don't know.
Well,
I mean,
in the review world, like with Yelp, there's the big problem with Yelp is that if somebody posts a bad review, you can't take it down.
Yeah, that's
okay.
Good.
But if you have a business or a practice that is making virtually all your patients happy,
yeah,
and there is one nutcase, and we always get them.
Yeah,
we always get them.
Yep.
Well, if you have a 5-star rating with Yelp, and you've got tons of good reviews, and there's just one bad one.
Yeah, I think the problem is when the dude only has 2 or 3. You know.
Well, there's where they have to start getting into this world now. It's a different world now.
And even too with like a Yelp, do they have it to where when the person comments, can you, as the owner, go in and comment afterwards and say, we're sorry? Kind of like a lot of hotels will do and stuff on their sites. 100%. So hopefully there is, yes, Mr. Thomas, and hopefully they're not anonymous enough that you can't just have the trolls in there putting stuff in. Hopefully Yelp makes sure there is a person behind us in a way.
You can go back in and say, our aim is to help everybody. We're sorry if so-and-so. They may not respond to it.
Yeah.
But the rest of the community sees it.
And a good heart that the other community will see it and they'll say, you know what?
This guy's a good guy.
Yeah.
It could be that's just a one-off. It could be a crazy patient. Everybody knows this.
Yeah.
It's where you have a 2-star rating and a whole bunch of negatives.
Yeah.
Most people aren't going to go to that restaurant.
Yeah, exactly.
Right? Or to that dentist or that lab.
Yep.
Okay? So, being active with that. And that also leads to having someone, again, whether you hire somebody like Dentainment or you've hired somebody in your own staff, on staff or whatever, who is active following all of these things. Active. There's a ton to do. I mean, every week I'm having some kind of blog put out, Pinterest, which another social media.
What's Pinterest? Is that
Pinterest is?
I thought that was like for cooking or something, or no, ladies or no.
No. Pinterest is.
Put a pin in it.
It's photographs.
Oh, is
it? Where people will pin a photograph and then people comment on it and then they'll repin it and then they'll put theirs. So you can have people commenting on your dental work if you want to do it. Okay. It's not the most important, I think, social media platform for dentists, but Instagram is important. Tweeting is.
I think we got Instagram,
Twitter,
or whatever.
Twitter, Facebook.
Facebook. And the Facebook Live is like, we've always been this way. We always just kind of, whenever we did videos, we just do it.
Yeah.
There's no script. We are really unscripted, but, the Facebook Live, it's one and done. I guess it goes out live. That's kind of...
Sure.
Weird. I mean, I didn't really understand it. It's like, hey, let's do a Facebook Live. And, okay, when's it going to be on? No, it's already on. And it's like, whoa. And then you go watch it, and it's like... It's pretty cool. But,
but it has to kind of fit into your profile and your personality of whatever your business is. For instance, back in the day, there were some people who would advertise on radio.
Yeah, sure.
And got a tremendous response, and other people would advertise and got nothing. Okay? So you had to analyze your demographic.
Yep.
And it's the same thing with the digital footprint is... Number one, who are you going after?
Well, you guys are lucky because you're going after all the people in the world because kind of everyone needs to see the dentist, in a way.
Yeah.
A lot of the public.
Well, yes and no.
Where I'm going after just dentist only. So it's just kind of, it's not worked for me yet. Maybe it'll work in the future, social media, a little bit. I think we're being seen a little bit.
It depends on...
We're a dental lab at the end of the day, and... the patients, what I would like you were saying, the patients looking into the dentist, what's your lab? I would like to get it down the line for us, that, hey, the patients, maybe we could go to the patients, the masses, and say, go to your dentist. And just, but it's different. But where you can hit demographics of, do you do children dentistry or kids or no? You
a little bit family dentistry.
So it's just not neglect. You're not like saying, no, I don't do.
No. But I'm not looking for people who need oral surgery, who need implants placed, who want to do root canals, this and that. Okay? But in your particular game, there are certain aspects in your lab that you do that maybe other labs don't. Mm-hmm. You have certain technology, or you may be more skilled in certain technology. Yeah. And part of, and we'll do this in a future podcast, is the relationship between dentists and labs.
It's critical.
Because I got to tell you, most dentists don't know who their lab guys are.
Yeah, absolutely.
They don't know what's going on. They just see the box come back and they see this piece of whatever it is, white in the box, and they look at what it costs.
Yeah, absolutely.
So you for sure have an opportunity to reach out to dentists to say, hey, look, we're going to educate you guys.
Absolutely.
Let you know who's going to be handling your work, and this is why we're doing it, and this is what we use.
Yeah.
Okay.
I think that's what it's getting
and
to.
And you could get it could be to me, a win. Right now, I wouldn't say we're on the early stages of social media or anything, but the reality is a lot of all of this marketing, the masses aren't doing like the dental world.
Yeah.
They're still conventionally doing it. A lot of dental practices get their patients from insurance companies.
Okay.
Okay. You get you as a businessman provide insurance for your employees, and the plan that you have tells the employee they need to go to these dentists on that list. Yep. And a lot of dentists rely on that, but they are selling their soul to the devil a bit.
They're selling it like it's just such a small fee that they're getting now that they can almost afford my lab. And it's a tough situation for those where the medical field, like all my guys, you can go and have an angiogram for $100,000 and it's 100% paid except for your deductible, a couple grand.
Sure.
Where you can go in and see a $50,000 rehab on a mouth, and you got $1,500 in insurance for X-rays.
Yeah.
So it's kind of it's a tough field. I mean, in dentistry,
definitely is.
The fee for service for dentists out there back in the golden days
was great.
And
it's a dying animal.
It really is, because I have all my big practices limited to cosmetics and fee for service. They're getting insurance plans now, and they're doing more of the things they didn't do before because out of necessity they have to do a few more root canals. Like my brother's an endodontist, and he said back in 08 and 09, when everything kind of went through the roof economy-wise, he started seeing less and less of the root canals because more of the GPs in town were trying to do them
to get some more money,
to get some more income. And so he was only seeing the nasty hardest ones, which a true endodontist, limited to endodontics, should be, I think, you got to work for it, and,
Yes.
But it's just something, a lot of those guys, even like my lawyers back in the day, they were like, my buddy has a law firm is mostly civil suits and stuff like that. Now he does everything, trademark, everything, because you have to. And he does, like you said, you do about, sorry, Dave, I'm not saying you don't do that great, but you're doing about 20% effort on 5 different things when you should be doing 100% effort on your one thing you do good.
Sure.
But when your income and your salaries are down, 50, 60% of what it used to be.
Sure.
You know what? You got to look at that lab bill. You got to look at that assistant. You got to look at that Mercedes payment. I mean, you got to look at stuff because you're seeing less patients.
Uh-huh.
And the whole thing with these dentists through all these past years, they never really had to market,
Yeah.
Back in the day, patients, word of mouth would be it. And now there's so many dentists and there's just so much competition, and it's hard, and dentists have to do some kind of marketing, so it's important.
And I'll tell you, just when you're just talking about that, right now we're noticing in the dental world that a lot of stuff that was humanly done before, we're moving to machines, right?
Yeah.
Digital impressioning, you guys manufacturing things digitally, because let's face it, our biggest cost is people.
Yep, absolutely.
Right. So you guys have a fabulous digital department. what a great opportunity to reach out to dentists to say, look, we can make you this stuff. You get it back quicker.
Yeah.
It fits beautifully. It looks great.
Yep.
And it's cheaper.
It is. It's just
It totally
amazing.
is. I can't believe how much
It's
better
really
it
an
is.
amazing technology that's changing the whole industry.
Yeah.
From what we had to do to make teeth 10 years ago to what it is now, it's a whole paradigm shift like you wouldn't believe. It's like, God, I got IT guys and stuff I'm looking at more than these master ceramists. I mean,
Yes.
I love
Yeah.
having the master ceramists and
You
the
still need
certified
them,
dentists. I
but-
still need them, but God, this the whole mindset. And I thank God for my children, my millennials that I have and, that are doing our videos. And,
Yeah.
it's just because I'm coming old dinosaur, just with the old way. So this whole interweb stuff's kind of new to me.
Interweb?
Interweb or it's just something but you got to get behind it. And we you talk about dentists not really doing a lot of it. Labs, I mean, there's probably less than 1% or a couple of
So
percent.
you should be jumping on the bandwagon, dude.
We're on it. We're not seeing anything really, but we're
It
gonna
takes
try.
time. It takes time to percolate and develop. But whether it be my business, your business, you need somebody to analyze properly who you're targeting and how to get those people to recognize your presence. And then it starts to snowball a bit. So Joe Schmo has a practice, and then he comes to you.
And then it's up to us to show the real deal and
There
make it
you go.
happen. So it's kind of cool. So let's wrap it up just for your outgoing advice on marketing. Like I know you use Dentainment just to get some, like I have a Mikkel over at 712 Marketing. He's my guy.
Right.
And he's a young guy and he's never worked with a dental lab, but he's working with your guy in conjunction. We're trying to figure things out. But what would you say for a dentist out there to get involved if it's a college student or a professional company, just to get it and invest a little bit in it, get your feet wet, right?
Sure, 100%. So, the younger generation now, they are virtually born with the cell phone in their hand, and they understand a lot of these social media platforms better than my generation or even the generation just behind me. But if they have the time to devote to really focusing on their social media presence for their practice, then they should do that as much as they are focusing on actually doing their dentistry. I would advise, though, if they're really trying to be a successful dentist, focus on your dentistry and research, whether it be a company like Dentainment or someone else who can be a partner with you. I mean, I could learn to be a lab tech, and there are some dentists that do their own lab work, right? But I don't have the time and the skill to do all of that, so I hire you. This is no different. It's another part of your practice. This is a different world. Like I said in the beginning, in the old days, you hung up your little plaque.
Yeah.
You had the FIFA service. There wasn't the competition.
Maybe the Chamber of Commerce.
Yeah, you go and have a little breakfast, and then everybody would know you. Those days are virtually gone. You have to be super proactive, and it has to fit your style of practice.
It's got to be real, and people will pick that apart
Very quickly. Yep. So that would be my advice: is to get that incorporated in your practice. Don't wait on it. The early bird
and
gets
work
the worm.
it with your website, because it all kind of
That's
works
the other
together,
thing too. You have to have a very, very active, up-to-date website.
Yeah.
I mean, mine is being modified or changed all the time because Google knows that.
Yeah,
If they see you're doing lots of video and things are changing, they acknowledge that. If you have a stagnant website, down you go on that. Remember, everything is about Google today. Just get to that first page for your community with Google, first or second page with Google.
That's just crazy. I always tell my wife, Google it, and she's like, "Shut up with the Google it," but it's kind of
That's
true.
what it's all about. Before it was yellow pages, yellow pages, yellow pages.
Yeah.
When was the last time you looked at a yellow pages?
Oh, forever.
Right?
Forever.
But years ago, you had to have that new yellow pages and figure out where you want to be on that. You want to buy a front page cover or whatever the case may be, right?
Yeah.
Now, no one cares about that anymore.
It was the biggest thing for a dentist to take out a yellow page.
Yeah.
And there was like $1,000 or something. But,
yeah.
If dentists can do it, it's something that, work on that website, get a little bit of the Facebook, Twitter, try to get that stuff going.
Yeah.
And, kind of like it's just what it is in the future for getting patients in your doors, I think.
Present now and future, and it's not going to go away. It's not going to go away. You know, it's a whole different world out here. You know, people have to start recognizing the analog world, even in our game, is kind of disappearing a bit.
It's crazy.
You certainly seen it in yours, right? I mean, if you didn't buy digital technology, where would you be right now?
I would be...
You'd be pushing a shopping cart on the street,
10
right?
employees, if that, and
Yeah.
it would be tough. It's just,
Yeah.
but we got on right when it was starting too. We
Smart.
weren't late to the game, and that's why we're doing this in the social media. We're getting up front of it, you know.
You
Getting
got
in
it.
front of the camera here, although we don't look as good as we used to, or I don't. But
yeah.
all right, well, I want to thank you guys for
Yeah.
listening in on this week. Thank you,
Thank
Dr.
you,
Ringer.
everybody.
You are the man.
Yep, nice.
Appreciate it so much.
We'll be doing it again.
We'll do it again. If you guys need anything from us, we got KeatingDentalArts.com/promo. And also for the podcast, you can go to KeatingDentalArts.com/podcast. If you guys got any ideas on any topics or any things you want us to talk about, please go online on Facebook and let us know. Again, we appreciate you listening in on us, and we look forward to seeing you next week. Thanks again.
Bye.